It's a great pleasure to be here, and thank you, Jonathan, for inviting me. Look, I also wish to acknowledge the traditional owners of the land and their elders past and present, but may I also acknowledge the lived experience in this room of those who experience mental illness and their families and carers. It's a great privilege to be here on this for this important conference, and to me to have the opportunity as the state's first Mental Health Commissioner to recognise your achievements as a group. The fact that this is the third BPD conference says much about how far we've come in New South Wales in achieving person-centred mental health reform, and how much more we can achieve by resolutely maintaining the focus and an open mind and a belief in the potential that every individual has to pursue their own personal recovery. Can I say that in my 6 years as a Deputy President of the Mental Health Review Tribunal, I did thousands of civil and forensic hearings. And I should stress that my background is as a lawyer, not as a clinician. And I can tell you that too often I heard clinicians say in those hearings around New South Wales that the priority was treating a person's symptoms of mental illness, and that it was not possible to consider their obvious metabolic syndrome, or their drug and alcohol issues, or their history of trauma, and of course, their borderline personality disorder. Now, given where we've come to already, it's remarkable, I think, that anybody could have thought there was a context in which we could successfully work with someone with a mental illness without having regard to all of those issues. And it is also, I think, a remarkable thing that across that area, New South Wales is showing very significant leadership. But it's true that quite recently, people have believed, particularly within the medical model, that metabolic syndrome was a reasonable trade-off for controlling psychotic symptoms. And until not long ago, that borderline personality disorder was essentially untreatable. And that is an incredibly despairing thing to think that in recent history we were to so fail to see the person sitting in front of us. We fail to see the complexity of the human spirit and all of the issues that are confronting people. And we somehow thought that we could split them into component parts and deal with one bit and leave the rest for everyone else to deal with. So look, many people have said to me since I became Commissioner in August last year that the Commission's statutory objective, which is to monitor, review and improve the mental health system and the mental health and well-being of the people of New South Wales, is just an impossible job. And of course, it would be if it was my job or if it was the Commission's job, but in fact it's clearly about the system. It's about how we work together as people to improve that system and to resolutely go forward. So I have to say that today, which is the first of these conferences that I've attended, actually gives me enormous hope, because it really says what we're capable of as individuals when we work together in a determined way to challenge the old stereotypes and to find new ways of thinking. And of course, it requires us to have a departure from what has essentially been what we call the medical model. I've got to tell you that I would have been delighted if the medical model had meant you always wore a stethoscope and were aware of what someone's physical health issues were at the same time as you were treating their psychotic or other symptoms. So clearly, I think there is much room now for us to feel some confidence that we're at least heading in the right direction. And can I just give you a bit of an update, perhaps, on this occasion about where things are at with the Commission? I can imagine many in this room may have heard me present around New South Wales, but I'd just like to take this chance to give you a bit of an update. We were established in July last year. We were tasked to develop this whole of government, whole of sector reform program for mental health. And I can promise you that it is not a one-off thing. No document, no piece of paper is going to do other than try and remove some of the barriers that stop you and others like you working effectively in the mental health area. But for the first of those, we're required to have that to the Minister for Mental Health, Kevin Humphries, by March 2014. There's a process we've got underway at the moment which is open to the public generally. It's an open registration process through our website, and we've had 716 or probably more by now people registered to be directly involved. We've also got a number of publications out which you can access through our website, including a document called Living Well in Our Community and a series of journeys papers which essentially guide our consultation processes. We're about to release another of the Living Well documents, which is a statistical review of mental health in New South Wales. If I could just go to the next slide. I just want to make sure you have met or know who our Deputy Commissioners are. We're incredibly fortunate to have 4 Deputy Commissioners, 2 of whom, Bradley Fox-Lewin and Faye Jackson, have a lived experience of mental illness and are well known in the mental health space for education and training they provide, and have been extraordinary ambassadors for the Commission around New South Wales. We also have Dr. Robin Shields, who many of you will know. Robin is an Aboriginal woman and is a psychiatry registrar, and Professor Alan Rosen, who's one of the great warriors in the space for mental health reform. And apart from many other things, being seen as a leader in community mental health and the original drive for better community mental health, Alan is also a man who has worked tirelessly for the past 30 years in far west New South Wales. We've also got a Community Advisory Council. I don't know whether we have any members in the room today, but there's 16 members drawn from across New South Wales with the job to advise the Commission about any matters that touch on mental health. And they are a remarkable group of people, and their names and details are available through our website. Just in terms of what's happening, look, I'm hoping that many of you in this room will have had a chance to contribute to this planning process. There's a very broad outreach that we started actually in late 2012, not 2013. We had a co-design workshop here at UTS in August, and we've got many workshop participants now working with us on a sort of a co-design iterative process in terms of the information coming out of those workshops. And we've also got a complementary process of consultations. Let's just go to the next slide. Thank you. So we've been mobilising communities with the New South Wales Consumer Advisory Group. We have a special outreach for people with lived experience of mental illness to make sure that they do not feel daunted by coming to forums like this, but can have a way of accessing this process and giving their contribution to it in regional areas around New South Wales. We're also being assisted very ably by New South Wales Carers of RAFMI with, to make sure again that we have care and family issues adequately represented by, again, giving them a separate opportunity to tap into the process with the Commission. We've had a series of regional forums which are still ongoing throughout September and October, including 3 forums in Aboriginal communities, which I think were completed yesterday. We have a special consultancy around children and young people to make sure that we give them a voice in the process. And we have a number of things happening around the culturally and linguistically diverse communities, including we're holding a major leaders forum in November with the assistance of the Community Relations Commission to make sure that we develop relationships now which will enable us to get to know communities of special interest where there are special needs, and to make sure that we don't assume that the system that we have is adequately able to cope with issues, say, with people coming from Vietnam years ago, who we're told commonly have problems in recognising and accepting that they might actually be suffering from depression. And that these issues, for instance, for refugee populations, as you'd understand, are very, very substantial, and we need to plan for them in advance. And as I say, we've had this special engagement with Aboriginal communities with the assistance of Aidan Ridgway. I can go to the next slide, thanks. But the public sector is really big. We really must make the public sector in New South Wales work together on these issues, and it's always, around the world, it's been the hardest thing to do. We tend to try and reform mental health from a hospital model, looking out into the community. And it really is about making sure that, you know, family and community services, education and transport and Attorney Generals and Justice all play their part. And that engagement has been going on for some time now. We've got a special thing going on with local health districts, just in terms of understanding the 16 local health districts in New South Wales and the special issues that affect them locally in terms of service delivery. We've had a special call out to the public for access to care issues, and we got tremendous feedback from carers and people with lived experience about some of the particular issues they've faced in accessing care in our system in New South Wales. And look, you know, the simple message for people who don't know anything about this area, which I get, is that we do some things quite well, but essentially we do not provide wraparound care for people in the community. We rely too much on hospitals, and many, many families and many, many people with lived experience will tell you the frustrations they've experienced in trying to get that care in the community. And we've been tapping into the Mental Health Coordinating Council regional forums and the recent New South Wales CAG regional forums. Thank you. Look, we're using this, I'm hoping many of you will see this, and it's available through this presentation, which you'll get access to, but we've been using this life journeys approach to make sure that we identify the issues at different stages of life, from birth through to old age, and through this process to make sure, again, that we keep the public sector at large accountable and don't let them see this as an issue for health. I mean, the fact is that old saying about, health to some extent is the ambulance at the bottom of the cliff is a really, really telling statement, because if you think of health in the way that it's about what you do for people when they've got a problem, you'll never hold to account all the other areas of the public sector for the work that they should be doing. And I should say, the private sector in terms of employers and others who make and can make and are making an enormous contribution in this space. Thank you. So ultimately what it's about, well, just like for you today, it's about person-centred, recovery-focused, whole-of-life approach. So whole of person, whole of life has to be a message over and over again. Focus on developing, essentially in the short term, better community-based care, which is do not have sufficient resources in that area. And in some troublesome ways, some of the resources that are meant to be in that area are still being directed to other priorities, including other areas of our public sector system, and in particular other areas of our hospital system. We have to maintain that true engagement now, for however long the Commission's working on this, with consumers, carers and families, in treatment and service delivery and planning. We really need to build this relationship with them and between them and us in the public sector. We need to focus on prevention and early intervention. I know you'd be surprised to know that there's sometimes quite a lot of controversy in this space. There are those who firmly believe that we can't deal with the current problems today and we should just focus on prevention and early intervention. And whilst I think there's enormous work to be done in that space, I don't believe for a moment that we should do other than ensure that we improve the lives of everybody currently living with a mental illness and do what we can in that space. We need to obviously focus on physical as well as mental well-being. And in New South Wales, can say just recently you will have seen, I think, the Minister announcing a commitment to the Healthy Active Lives for Young People campaign. The work that's been done by Jackie Curtis and others in this space in New South Wales is truly inspiring in terms of the leadership it's offering to make the profession generally, medical profession in particular, realise that you have to work with the whole person. It's not acceptable that any young person who experiences a first episode psychosis should ever go on to develop metabolic syndrome. Trauma-informed care, again, leadership in this space in New South Wales is something that we need to tap into and make sure is rolled out across the public sector. And then, ultimately, considering all those other issues, education, housing, justice and wellbeing. And I have to confess, it's the hardest part of this, trying to get these big other entities to change the way they do business to make sure that we actually provide the best opportunity for young people in particular to develop resilience, and that we accept that for the time being our criminal justice system, our corrective services system, is housing vast numbers of people who are there at least partially because they had an untreated mental illness, or that they never got attention for their borderline personality disorder, or whatever. The fact is, at the moment it's a storage system, it's not an effective treating system, and we have to work more effectively in that space. And then the last thing I've got there is research and evaluation. We need to embed research and evaluation in everything we do. We need every person working in the mental health space to feel that they've got a role in research and evaluation, so that we actually commit to a continuous improvement in this cycle. So that when we do work with borderline personality disorder, we find a way of rolling that out across our entire sector in New South Wales. When we do work with trauma-informed care, that it actually reaches everybody in New South Wales and it doesn't become some isolated centre of excellence. So for BPD, then clearly back to person-focused, responding to the person, not the diagnosis, seeing all of their needs and making sure that we hold hope for them, just as we want them to hold hope for themselves. And that we ensure equal access to talking therapies as well as medical treatment. It's an extraordinary thing in our system today in Australia that Medicare will fund any amount of access to doctors and to psychiatrists. But if you want to get access to a psychologist, then there's some titrated system you have to go through. Now, we know there are budget issues with everything, but unless we commit to ensuring that people have access to talking therapies earlier in the piece, we won't deal effectively with these issues. And finally, destigmatising this area with profession, related services and the broader community. I think you'll find that within the areas of general practice, your local GP, stigma is an enormous issue for borderline personality disorder. And doctors will often refer to this area as, oh no, That's one of my heart-sink patients. I'm having trouble dealing with their issues because they've got a borderline personality disorder. But they're actually not getting much assistance in how to work in that space. And finally, of course, all of us, as leaders in this area, instilling hope. We have enormous achievements in New South Wales. We just need to make them available for everyone in New South Wales, and to remove the blockages. 800,000 square kilometres is a huge challenge, probably in a sense because of our population, almost more than any other state. Because we've got a big population, Australia-wide, in terms of Australian populations, but we have a very, very challenging and diverse state to try and get those services to. So thank you, and I want to wish you all the best for this conference. I'm very much hoping I'll get to the 4th BPD conference next year. Thank you.